Chamge chitab kalenjin itagaten tetutetab Health Watch. Tagetestai ak tetutetab cancer, kemiten ak founder ak CEO nebo Angaza Counseling Center.
Thank you very much, Karen.
Today we are talking about anxiety and depression for cancer patients. Or what are the factors that can lead a cancer patient to get anxiety or depression?
Okay, so for one, being diagnosed with cancer, that is something that can really take a toll on you, considering we know cancer can be a terminal illness. It's costly. Treatment of cancer is costly. You are not assured how long, like there are a number of questions that you have. You don't know, like, if the insurance will cover, what will your family say, will you get the support that you need for them, how about your job, will you be able to retain your job, or you need more rest because of this illness. So the uncertainties that come with the diagnosis is where this anxiety and is in.
So far we know that 1 in every 3 cancer patients have anxiety or depression or both. But at the same time, cancer symptoms present as anxiety or depression. They are more or less the same. So for a patient who comes to you, how do you be able to tell that these symptoms are actually not just for cancer, but there's it's inclusive of anxiety or depression or both?
Okay, so you're right there when you say anxiety, depression, and even cancer can have some symptoms that are more, they are similar, because there is sadness, there is feeling tired, an interest in doing things. But for a cancer patient, you can tell that now it's no longer anxiety, it's getting to the point of depression, or it's no longer cancer alone, there is much to it, especially with their mental health, is someone suddenly becomes disinterested in a lot of things, even going to their doctor's appointments, which they are important, because as a cancer patient, visits to hospital will be frequent, but somehow this person has started losing interest in going for the visits. Then someone might start engaging in harmful behaviors like too much alcohol. And another thing is, maybe you're supposed to exercise more, but suddenly, you know, you're no longer interested in doing the things that you know they are very important, considering the kind of sickness that you have.
And what are the effects of having depression or cancer, untreated depression or anxiety on a cancer patient?
Okay, so some of the effects, or some of the effects that come with ignoring depression or not being able to tell that a cancer patient has depression is, one, this person might stop taking their drugs, this person might stop going to the doctor, or they might engage in these activities that we've said. Some people get to engage in harmful activities, even away from the alcohol, but maybe eating some foods that they're not supposed to eat. You know, it's like they have given up on a lot of things, so they start engaging in activities or in things that will fasten maybe the tumors or the progressiveness of the disease that they have. So I think that is the thing that comes in with not being able to treat or ignoring, because, you know, for cancer, if someone has cancer, I'll end up, or most people end up focusing on the cancer itself. People end up talking about the disease itself and forgetting about the other things that come up with having cancer. I know a lot of changes will happen. Someone who has cancer, we told the treatment that one has to go through, it comes with hair loss, maybe loss of weight, but at times we are not prepared for this. And when they come in and I'm stressed to a point of depression, I'm anxious, I don't know if I go to hospital the next day, how will the bill be? Will the insurance cover the entire bill? Then the doctor has told you about some things that you have to do. Will I have enough money for this? Will my employer be always ready to give me these off days or sick leave or bed rest? Things.
And so when a cancer patient comes to you, what are some of the tests that you take them through before you start the treatment?
Okay, so mostly it's about talking, getting to know or getting to understand their perspective about where they are at that particular moment and how they feel generally, because yes, I'm giving you counseling, but at the end of the day, you as the patient, it's you, or you as my client, it's you who knows, or it's you who has the key to your relaxation, or to the key to your peace of mind, where most of the time you are at peace, the medicine is working well, because without that peace of mind, you know, there is a way that your body cannot work well if you are not mentally stable. And so if you come to me, that's the conversation we'll have, so that we can see we are journeying to what point and at what level are you in. There are some few questions that I'll ask you to gauge and see if is it the normal anxiety that comes in with being a patient or with being diagnosed with such an illness, or now it has progressed to depression or even major depressive disorder. Yeah.
From this talk, what I'm getting is that most of the whatever happens around a cancer patient affects them internally. Like you've said, anxiety of how they'll pay the cancer treatment fee, how maybe hair loss, or how maybe family will take them and all that. So what are some of the mechanisms you can tell a cancer patient to adapt in order to help them control whatever is happening externally, so as not to affect their internal, which is now their mental health?
Okay, so one thing is, one, you are not the first one to have cancer, and definitely you won't be the last one. There'll still be more cases of cancer. So one thing is, if you can be able to find other people who've had cancer, have a support group where you can hear someone else's journey and you'll realize maybe I'm better, or maybe I'll get to this point also. So yeah, get from your doctor, you can ask if you can be linked up to other patients or other cancer survivors.
Support groups?
Yeah, support groups which might be in existence, and be with them so that you can have such conversations, because it's the wearer who knows where it's
Where it hurts
the most. Yeah. So if you get to associate with people who've had this, it will be better. If a cancer patient or if a cancer survivor comes and tells you, don't worry, you'll get better, or it's tough but it's worth like persevering the treatment and all, and like someone who has never had cancer telling you the same, you know, you'll believe this one who has already experienced this other than this other person. Another thing is, cancer patient can talk to their doctor. Ask your doctor as much questions as you want. Ask, maybe there are some things that could be myths that you've heard outside here, and it's your doctor who has the best answers, or who can answer you well, because he's the professional in this. And then another thing, you can also ask your doctor if maybe you might be in need of counseling, or more medication, or a second opinion, or anything like that. Just ask your doctor. Never be afraid to consult your doctor when it comes to anything. Then another thing is, be open to being supported by your family. Don't feel like you are burdening people, because you are their loved one, and they are here to support you. So allow them to come in and support you. If you need someone to run some errands for you, if you need someone to stay around in the house with you, allow them to be there. Don't push people away. Then, you know, you can be a perfectionist at some point, maybe when you're okay and there is a specific order which you wanted your things to be done. But for now, just take your time, you know, sit back and concentrate on your health, and let other people assist you. Don't be always there to point fingers or to say this has not been done well, because I think you should now reduce the things that stress you, considering you have something that is really eating you up. Yeah.
Talking about family, most of the time when someone breaks that information to the family members, I mean, many people think that cancer is a death sentence. So they start breaking down. Irrespective of how strong the cancer patient might have been, this also breaks them. And so how should we, or how should a family member behave when they are with a cancer patient, so as to not to affect their mental health?
Okay, so talking about the family members, which it ends up being maybe there's one specific caregiver or the entire family is a caregiver, they take turns in it. And you know, it becomes a challenge because you don't have the professional background, you don't know how to handle such a person. So you should also think about yourself first before even, because if you're not okay, you will not be able to assist this other person and you'll be making the situation worse. So what of, if you need to relax, step aside and relax. You don't have to work hard. It's like you're seeking some approval, or like you want to be seen at the expense of your own health, be it mental or even your physical health. So as a family, or as part of the caregivers, you should take some time off and allow other people to also step in and take care of this person. And you're feeling overwhelmed, going for therapy is also good, getting counseling, getting support, and maybe seeking, you know, nowadays there are some short courses about for caregivers, maybe first aid or how to give the drugs and all that. So if you feel you really need it, you can go for it. That is, if the things around, you know, cancer comes with a lot of responsibility, especially the financial part. It can be really strenuous. So if you can, this is something that you can go for, so that you can, as you take care of this patient, you've also taken care of yourself, and you'll be a whole happy family, knowing that whatever you're doing it the right way, so that at some point you don't blame yourself that if I had done this, the outcome would have been different. Yeah.
And I believe one of the first things that they say during a first aid class is that ensure that you are safe before helping the other person.
Yeah.
Okay, let's move on to the words that, or encouragement that you should give to a cancer patient. Because at times you may say something out of the blue, and probably this cancer, okay, of course when going through whatever treatment it is, someone becomes a bit sensitive. So how should we talk to these people?
Okay, yeah, and you've mentioned something really important, because another thing that the family also experiences is, or the patient experiences, is something like stigma. People get to avoid them because what if I say this and they don't like it?
Yes.
What if I start comparing this one with someone else? So I think there's a part that I'd said, you are not the first one and you won't be the last one, but it's not a good thing to tell such a thing to a patient, eti wewe si wa kwanza kupata cancer. That hurts. Like, mimi si wa kwanza na mimi si wa mwisho, but why did it choose me? Yeah, I'll be having such questions, and definitely you won't have an answer to that. So avoid such statements like wewe si wa kwanza, or avoid comparing them with other people, because their journey is their journey. Let such conversations be conversations that they'll be having with fellow survivors, where they can have, because I'm talking to you as a survivor, so I know how this is. Another thing is, don't bring in the cost implications of the disease. So I'm already sick and you're telling me that, hii matibabu nayo imekuwa expensive. Sijui tutafanya aje. I'll give up because I'll feel like a burden. I'm a patient and you're already telling me about this is becoming challenging. Yeah. So you should avoid negative statements. Yeah, we can say all the negative statements. You should avoid them. Yeah.
Last week was World Cancer Day. And one of the main theme that has been going on from 2022 to 2024 is bridging the gap. One of the biggest gaps we have, not only in Kenya but worldwide, is support for their mental health. What would you say about that?
Okay, so I think, or what I would say is, as I had mentioned earlier on, we tend to forget about the mental health of not only cancer patients, but any other person who has a terminal illness. It's like we end up focusing on the illness on its own and forget that this illness, it has affected them physically, yes. How about emotionally? There is anxiety, then there is stress, there is depression. Someone has a lot of questions because you are well and I'm the sick one. What did I do wrong to be the one? Yeah. So I think it's time even before we get to the illness itself, or about the mental health of this person who has been affected by the disease. How are they coping with the situation? How are they coping with all the challenges that come in with being a cancer patient? Because, you know, I think many times we've seen this as death sentences, you had said. So, you know, is my will ready? Who will take care of my children? Or how are my parents? Will my property be well taken care of? How about my job that I love so much? How about the wealth that I've been able to amass all these years? So is it going to waste? Will the savings that I have, or will the medical insurance that I have cover all the bills that these will bring, or I'll still get into the pockets of other people? And then how will people come through for me? This is the time where you start asking yourself questions. So have I been good to people? Have I been responding when people call me for fundraisings? You know, you'll be having a lot of questions. That is why we should focus on talking to them, or allowing them to make peace with these situations, so that they can be able to make saner decisions going forward, or they can at least be relaxed going forward. Yeah, and I think this comes in where the doctor, maybe the time they realize, you know, you're telling someone, so this treatment, you have to go for 5 rounds of chemo, and it's going to cost this amount of money. Like, you're not even thinking about, are they able? Or a way to approach them. So are they getting prepared? Okay, I've never experienced one, but I'm wondering, are they prepared emotionally for this to come? Ama you just break the news evil without caring how they'll take it, without caring how maybe they are prepared. You know, I'm wondering if when it comes to cancer, what if we prepared people? I think treatment of HIV is cheaper than treatment of cancer, but do we talk to people the way we approach HIV patients? Is it the same way we approach cancer patients? Because I feel cancer is worse than HIV.
In terms of stigma as well.
In terms of stigma. Okay, HIV can be worse in terms of stigma, but now when it comes to cancer, the cost implications, cancer is worse. And I think imagining the turmoil that you'll have to go through because of cancer, we should give it not really the same approach that we give to HIV, but somehow we should be more friendly. The way we are so careful, you know, it's like when approaching an HIV patient, like, you're so careful, the way you choose your words, the way you do everything, you're so careful. What if we do the same for cancer patients? Not because it's a bad thing, or not because it's as bad as HIV or anything like that, but because the emotional torture that comes with being a cancer patient is way worse.
Thank you so much, Wendy. As we wind up, maybe you can give the audience a tip or two on why it is very important to not only just talk with a psychologist, but to have someone close to them whom they can talk with.
Okay, so it's important to have, you can say, some people call accountability partner when it comes to businesses, but how about having an accountability partner when it comes to your mental health? There's some days you wake up and you're so low, like you don't feel like doing anything, and if it progresses for a week or 2 or 3, that one, it's no longer normal. That one is getting to the point of depression. Do you have someone that you can talk to when you're feeling so low? Do you have a trusted partner that you can tell them, today I'm just low, I don't have the energy for anything? So it's good to have someone to talk to, and it's not necessarily a professional, but you should just have, let's call it now, an accountability partner on your mental health. Someone who can tell when you're not okay, can come to you, Karen, and tell you, by the days that I do this and this and this, just know I'm worst. And on these other days, I'm just okay. So if you see me doing this, just know there's something. Something is amiss.
Thank you so much. Before we wind up, we talked to a cancer survivor who tells us why it is important to have your mental health in check, more so when you're going through cancer treatment.
Now, for emotional well-being, what I would say is get rid of all negative energy. Get rid of all negative people that would hinder your journey to wellness. With all due respect, a lot of husbands walk away. In sickness and in health, it's not just about the man's health. If your wife gets diagnosed, please stand by her. It is daunting, I know, and we need to create awareness in terms of how to cope, not just for the patient, but also for the caregiver and the family that supports the patient, because you make the patient's work lighter in terms of getting well, but also you also can look for your own psychosocial support that would enable you cope with the illness of this person that is near and dear to you. This journey requires resilience, it requires faith from whichever deity you believe in, a lot of faith, and it requires for one to tap into every strength that they have.
Available.
If you tap into every strength that you have, then chances of you getting better are higher. If someone close to is diagnosed, please don't worry. It is the worst thing you can do to someone who has been diagnosed with cancer, because everybody knows it's a death sentence. So don't make it worse by crying, don't make it. I refused. I said, I have friends and cousins who, I said, no. We are not going to talk until you're ready to talk to me without crying. So I was very calm. They say, oh, Mary, I said, no, we are not going to cry, because if you cry, then what am I going to do?
Chitab Kalenjin, ongetuyen e wiki nenyone stakemuch kengalal akobo tetutik cheterter chetinyeke ak borwekyok. Kainenyu ko Karen Cheriot.